Hi, this is Jessica Shabby. I'm going to be doing the colostomy change, dressing change. So the supplies that I have is I'm pretending that this is my skin prep. Clean gloves. I don't have any ointment or anything, so I'm just using a remote towels and washcloths. I have my measurement, pair of scissors, waist bag, and of course my stoma dressing and skin. So I'm going to go ahead and get started. This is going to be Mrs. Smith. Hi, Mrs. Smith. It's Jessica, your nurse. I'm going to go ahead and wash my hands. Can you tell me your name and date of birth? Awesome. I'm going to just check your wristband, okay? Great. Now I'm going to go ahead and change your dressing and and make sure everything looks okay. Is that okay? Awesome. So I'm going to go ahead and bring her up or down, whichever one. I'm going to go ahead and bring her up because I would be standing. So first thing I'm going to do is I'm going to start getting you all set up, okay? I'm going to take this towel. I'm going to bring down the blankets a little bit. I'm going to take this towel and I'm going to put it right on the side here, just in case that we get messy or anything like that. So next I'm going to go ahead and grab some gloves, some clean gloves. And Mrs. Smith, the first thing that we're going to do is I'm going to take the bag off. Is that okay? Okay, so I'm going to start by the corner. I'm going to make sure that we're not doing any damage. I'm going to slowly move. Awesome. And then I'm going to go ahead and go to the bathroom. If there's any liquid, I take it all out. I empty it. I measure it. And then I chart it. I'm going to go ahead and toss this. Okay, I'm going to change my gloves, wash my hands, put some new gloves on. All right, Mrs. Smith, I'm going to go ahead and clean around it, okay? I'm going to gently clean around the skin first with some warm water. I know it's very tender. Just a little bit more. Okay, next I'm going to go ahead and clean the stoma with some more water, being very gentle because I know it's very sensitive. And sometimes bleeding can occur, but that is completely normal. All right, next I'm going to pat it dry. Okay, now I'm going to go ahead and take this time to assess it. I'm going to make sure that this is nice and pink and beefy, make sure that there's no ashiness to it, no discoloring, and if there is, I would call the provider right away. I'm also going to check the ends all around the skin to make sure that there's no irritation, to make sure the skin is nice and healthy, and this one is. So I'm going to go ahead, Mrs. Smith, I'm going to go ahead and measure first. Would you like a mirror to watch everything? Okay, here you go. Now I want to make sure that it's not too loose or not too wide and not too close together. So I found my perfect measurement. And then I'm going to go ahead and take this. I will trace around with a pen and then use my scissors to cut around it. All right, Mrs. Smith, I'm going to go ahead and add this to it, okay? All right, first I'm going to put some skin ointment. Make sure that that's all good. Or some skin prep, sorry. And then I'm going to put this down, making sure it's nice and firm, but not pressing too hard because it is sensitive. Next, I'm going to take a brand new bag and gently pop it into place. And then I will go ahead and tighten this and clamp it off. Perfect. Mrs. Smith, are you feeling okay? Did that seem to go really well? Good. Do you have any irritation with that? No, you're doing all good? Okay, so I'm going to go ahead and either lower her bed back down. I'm going to ask her if she needs anything. I'm going to wash my hands. And then I will chart and let the doctor know if I've seen anything. Her skin looked great, so I don't need to report anything. I'll chart everything, and then I will leave.